a more direct discussion of his poetry, the place of poetry in our world and in the classroom. In the spirit of letting a poem speak for itself, I'm going to read one of Fady's poems. It's part 13 of a long poem called Pulse. And I think this poem says a lot about what it means to be a doctor, what it means to be a poet, and how you look at the world through that kind of binocular vision. In paradise, hospital beds sit under ageless mahogany and sycamore that bear every kind of fruit. Hot meals are autumn leaves, branches are waitress arms, and also poles for drips. And birds drop the pills in your mouth from bills of surgical precision. For aspirin the swallow, for Benadryl the nightingale, no harm befalls you. The roots will sense your ailment, the flowers will scan your organs, geranium for the spleen, poppies for the brain, and where there's a latrine, a jasmine vine will blossom. All the biographical information you need is on the description, and so it's really my pleasure to welcome Fady. Fady, I met Fady, we were dorm mates at poetry camp, and it turns out that Debra did some training at the same program in writing, so this is sort of a little alumni reunion for us. So Fady.
I am thankful for you coming. I'm also grateful I don't have to talk about my poetry because I'm not so sure I'm very good at it, talking about it. And what I have is a PowerPoint slideshow presentation of my day's experience in Darfur with Doctors Without Borders. 2005, I stayed there for 5 months. Lived with the community in a small town called narrated, near the central volcanic mountain range that represents to the 4 people and to the entire country of Sudan sort of what Niagara Falls would mean to us, or the Grand Canyon. A very unique geographical place. And so it is particularly interesting to be in the middle of a place that has that kind of national identity at a moment where the entire peoples of a country are coming apart. What happens, obviously, when one gives a presentation that of any kind, but particularly a visual one, is that a choice is made. I have made my selection process of photographs. And I think that what you will see will reflect what I have done in general when I was on those missions. I've done another 6-month mission in Zambia in 2002, which is to concentrate more on landscape and shy away from representation of the people there. This may come at a price, at a fault of my own, and it may not. My notion is and has been that our representation of quote-unquote the other, especially when the other is outside our boundaries, is always difficult to overcome stereotypically. No matter what we try, these people are always the people who have never understood the concept of the nation state. They happen to be poor, and all sorts of implicitly or not compassionate but perhaps derogatory adjectives. And so I think that as a physician, even practicing within the United States of America, we come through the same things. I am we are trained during residency in medical school to begin to exclude certain people as problematic patients because, for different reasons, the list goes on and on. And this is obviously where I won't have time to go and give you my opinion on so much, but I think this is sort of the elephant in the room. So hopefully my conversation and slideshow about one experience with Doctors Without Borders would somehow find a parallel in some of you or many of you about the way we actually practice or don't practice medicine. I would also like to say that, well, actually, it doesn't matter since I will be. So this is a map of Sudan. Right here at the intersection of these three lines, the three provinces, is where the Jebel Marra is, which is the volcanic area. And the entire Darfur region is a semi-desert, or more than a semi-desert. And so only parts of it, because of the volcanic mountains, will get a rainy season and have enough water for sustain life, both pastoral, agricultural, herder lives. This is a map that shows the variety of ethnicities in the region. You can see here the Zakawa, the Masali, the Fur, other tribes, and some of these names, the various names, are what are called the Arab tribes, the herders. They're mostly the herders. The others have been more agrarian throughout the centuries. And so I'll leave it at that. We'll get to those earlier. So this is also another picture of the landscape. This is a whirling sandstorm. I remember that one of the translators, most of the people spoke Arabic. I speak Arabic fluently, but some of the time some of the people spoke the local languages or the tribal languages, and we needed or the Fur language in particular, since this is they are the predominant people there, and we needed translators. So one of the translators told me that in folk tales, that a whirling sandstorm is a devil waking from sleep. So this is Jebel Marra. You can see this is an example of a wadi. This mountain range is about almost 12,000 feet high, so it's one of the highest in East Africa, or in the entire African continent. This is where we were. To the left of it is the town. This is a very big wadi, riverbed, dry riverbed. You will see in the distance here, this green is actually where some people have established their farmlands. You can see here's a farmland by a bend in the river. If you can afford to buy a water pump and have it there, then you become a more successful farmer than others do. And here's another example of farmland. Here's exactly that pump, probably one of two pumps in the entire town. And you can see that, you can imagine actually that what happens in the dry season, where water is scarce and only few areas hold their greenery, if you will, that there is a competition over sources. And this is where the conflict always arises and has arisen for about 40 or some years, especially with modern weaponry, actually, is what I mean, but obviously this is an ancient thing. So in this photograph, you can see these are the camels of an Arab tribesman, and these are the sheep and goats. And they're on the hills opposite of just the photograph I just showed you. And I know, I took that picture because I shortly after watching this, some of the camels and the sheep crossed the riverbed, went into the farmland and started chewing and destroying crops and so forth. And this is where you'd have somebody shoot somebody's cow or goat or so forth, and then they'd shoot back, and you'd have a whole revenge on your hand. Before going further, to start the description of the situation in that manner, I always like to be both problematic, I guess, and, well, I don't know what, but, and say that this is not necessarily different, although we like to think, I don't think of it as different as us arguing over oil. But it's always interesting that if others, or anything else, but if others kill each other and their neighbors, it's always better, worse somehow than if others kill distant others. And this is, I think, a similar problem somehow with the way we practice medicine, so also within our own community. But it's also problematic to represent the problem of Darfur as that, as what I just did, because that somehow necessary analysis does dilute the suffering of millions of people into some sort of a logical explanation, historical explanation. Similarly, the way we represent the suffering of others on CNN and in newspapers and even on campuses also dilutes that universalization of suffering. Meaning, I was shocked, I was not aware of this admittedly when I went to Darfur, nor did I choose to go to Darfur. I just simply called Doctors Without Borders and I said, hey guys, I'm ready for a second mission. They were going to send me to a different place first. I wasn't ready. They wanted me to be ready in 1 week, and I wasn't. And then they called me 3 weeks later and said, okay, Darfur. So there is this notion when I say Darfur, people will think that I've just sort of had made that conscious decision to go to that hot spot of suffering in the world, whereas for me it was just any other place where there is devastation and severe deprivation would have been equal and just as worthy. But for us here, probably there's a particular focus that has much to do with the dilution of the universalization of suffering, which I think we've become sadly quite accustomed to. I continue to show, this is the village before the war, meaning this is part of the village that was not destroyed. This is one of the few villages that were not destroyed. You can see there's a brick building here. This happens to be the extension of a compound of one of the richest men in town, who is the man we rented our places of stay from. Which is to say, we go there compared to our lives here to live in deprivation. There's no running water, there's no, food is really not available and so forth, but we really live there as kings and queens. We have a maid who made my bed. I don't make my bed here. Washes my clothes and so forth. So these are details that I like to mention. So here's another view of a compound. This is people in the neighborhood. This is another view. They would have, if you can afford it, a large compound that probably has a hut for the kitchen, one for a guest room, one for a salon, one for private bedrooms and so forth, and relatives and whatnot. One of the reasons I like to show these pictures, which again, they may not seem exciting, is because I remember coming back from 2002 from Zambia and giving a talk about where I was in a refugee settlement, only to have an elderly man come up to me and say, but this really isn't much different from the conditions they were living in before. And it was a shocking statement for me, because I think that I realized then that the pictures don't show one thing, and it's so sad that we would forget that thing so easily, which is human dignity. I don't think people who lose their homes or their sense of home, that the tragedy that they undergo psychologically is something that can be measured in photographs. Up along the only desert road
there were hundreds of villages that we've passed repeatedly, because I had to make trips from where I was to the town about 70 kilometers to the west, where there was only one hospital, which wasn't necessarily functioning very well, when I needed to refer some of the patients there. And this is what we passed. Hundreds of them across the entire desert. I hope that this is somewhat of a stark difference. Even the trees are not alive in those villages. And this is really, was really important for me to notice, because I guess the trees don't really, some of the trees were burned, and some of them just, I guess they need to know that humans are around, and some go on without us. Every village like that had a big black tire at either end with 2 acacia tree limbs as a stop sign, and soldiers waiting in the shade who would or would not care to stop you every now and then and ask you for cigarettes or just bother you or whatnot. But the reason they were there is to actually prevent repatriation. So they did not want, because now the history of the entire region and the landscape and the geography is changed, it's been altered forever. And even when you speak to many of the civilians and the people who have suffered these atrocities, they'll tell you, we don't want to go back anymore because we've lost something that is unrecoverable, which is our own sense of what peace means, what safety means. They cannot trust that there will be safety, at least not in those places. So moving to the third landscape, which is the landscape of the refugees. So there are the destroyed villages, the first ones where it's this normal living. Now outside those 2 towns, the refugees that came from those villages that were completely destroyed had to go somewhere, and they were put up in these places, makeshift places. Again, going back to that comment, they may, aside from the white tarp, they may seem as if they're not that different. But really, there's a whole art that goes into building, and they know where to put places where when the rainy season comes, it will not erode the houses, where somehow there is more shelter from the cold, where there's a space for a latrine, and so forth. And I was stunned to actually come upon these things as time passed. Staying there 5 months, I came before the dry season and went through the dry season. You realize the problems that happen to the refugees, that occur to the refugees who seem to just be building or using the same quote-unquote building material. And of course the tarps become an interesting introduction to people, because it's sort of like the zinc roofs that only a few rich people can afford. Now the tarps become a commodity, but they're really miserable in the heat. So it's an irony of introducing, quote-unquote, these new things in abundance, whereas the old things are probably better. But this obviously works faster. The reason, the thatch roof is much more efficient, but you have to wait for the dry season to happen so you collect here. And they don't have that time. They don't have that peace anymore to. This is back in my town, in Nertiti. So those beautiful homes and complexes that I showed you, now the people had to come and live within those neighborhoods. You can only imagine from a medical standpoint the diarrhea that would ensue and that did ensue, and the hepatitis that broke out, an epidemic that broke out upon the arrival of the first refugees. Nertiti was a town of 20 to 25,000. When we arrived with the catchment area of all these displaced people, it became a town of about 50,000. And obviously in those environments, people expand at a rate that usually sustains their needs and growth and in accordance with the resources. And this was too much of a flux, and it makes everybody stressed or come close to distress. This is, I never asked why, but this was one of the 2 or 3 call them donkey parking lots, by the main road. There is a beautiful novel by, I think, well, I don't know where he's from, actually, I always get confused, but his name is Munif, Abdurrahman Munif, called Cities of Salt. And he describes in it the love affair, the affection that this Bedouin man has for his donkey. And it's really interesting even to see our own disparity, almost derisiveness, I think, towards others' relationship with animals. You know, if it's not a certain type of animal, then they're either primitive people or something weird about them. But it's really, I have to tell you, it's a beautiful and a wonderful experience to live among donkeys. They're wonderful, kind creatures, and they do endure a lot. So this is another. This was no longer there 2 months after I arrived. But when I arrived there, this was a public latrine mall. So all those refugees that came and packed those neighborhoods, right across the street, the team before me had to build a latrine space for them. Like I said, even these issues, I mean, it's amazing. You can see here there's about 10 others are about to be used. After it was removed, and I think that people eventually solved the problem on their own, a hill just right next to it, nearly 10 feet to the left, was used for burial grounds. In fact, I know that I attended the burial of one of the children who did not make it there. This is a view from inside the cafe close to where we lived. It was a nice retreat. These women are back from food distribution. Oil is what they're carrying, and these women are back from a hard day's work. Firewood and thatch for various purposes. And I like to show this picture because of the next one. So here's an Arab woman bringing on her camel massive wood. And you can see that obviously the wood a camel can carry is a lot more than a head can carry, a human head. And this was the case prior to the war, speaking of the economics of war. And so what happened now is that, I'm not saying that this woman is part of the tribes that that perpetrated the crimes, or I don't know that, but not all the tribes were, so she could just as easily just be someone who had this idea, wait a minute, the refugees can no longer leave the refugee camps or the towns and feel safe to collect wood this massive, but they need this kind of wood, so we will go cut it, bring it in for them and sell them and make a profit. So, good capitalist idea, I think. And here's a kid taking the donkey to the well to get some water. Here are the natural wells that the population in each area developed through their natural life cycles in the riverbeds. So you can see that the fortification of the well, and this is one of the major dry riverbeds that I showed you at the beginning. The kids will go get the water and come back. When you have a sudden influx in the population, you're going to have increased incidence of diarrhea and illness, and the water is obviously overused, too many people step in it and so forth, and it becomes a hygiene problem. And it also becomes a resource problem. There just isn't enough naturally dug wells to support the new population. And so come in the philanthropist NGOs, and we really look great on CNN, I have to say, and we dig wells. Or we find one artesian well and then we do a pipe system. And then this is a very interesting thing. You see, there are far more mini jugs than there are women and children, and it's because it takes such a long time to pump that they'll just leave their jug in line and go do their thing and come back, or leave a child there. It is not unheard of anywhere across the world. I'm not telling you anything that doesn't exist in other situations in the world, so this is not specific to Darfur. And that's the part of the fascinating story about this, I think. That many fights break out, that soldiers or rebels or whatever, men with guns come and they will beat up people to break the line, to get their water and get away with it. So we've had to deal with a few traumas where people just come in busted up because a soldier decided. And of course the soldier will decide to do that because they're afraid if they stand in line, they'll be easy target. And so they decide to use a shorter means of achieving what they want. So here is the pump, and sometimes I've seen two people work it. It's hard work. It's a lot of muscle power. So here's I don't have many pictures of patients, and I've only taken them because my mentor encouraged me to. So here's a picture of a man with jaundice. One of the people, when I showed this before, he said, "Oh, it's great that the fly is on the nose bridge," and I had no idea. I was not thinking anything like that, but here's a child. What I dealt with mostly over there were the problems that children suffer. Children under 5 years of age are most susceptible, as are the people older than 65, or the children died at a fast rate if we did not intervene. This is a classic picture of a child with kwashiorkor, a severe protein deficiency. We don't know enough about how to treat malnutrition, no matter what anybody tells you. Just like we don't know enough about how to treat obesity or morbid obesity. And when I say that, I preface the story with that because this child died the next day. It is usually a brutal treatment to the body to begin hydration or begin introduction of milk with nutritions and with nutrients and minerals, and the body just cannot tolerate it, and they go through a very rough process, and it almost seems like you just hope, in some cases, in some very extreme cases, that they just pull through the first week, and then after that, chances are that they will do better. And this child did not. But luckily enough, we did not have too many deaths. We had actually few deaths. This is a child who comes also with features of marasmus, the other kind of malnutrition, skin on bones, and the distended abdomen. This is an interesting narrative perhaps, because there are these criteria that never made sense to me, having done 2 missions and seen so many of these children, where the circumference of the arm has to be up to a certain number to be qualified to enter the severe malnutrition program, which is the aggressive treatment, versus here's a extra bag of food, go home and see if that helps, and here's antibiotics and antiparasitics and whatnot, and see if it helps. And sometimes it just didn't make any sense, because we don't know enough, and these parameters are incredibly arbitrary, and when you practice it long enough, you know something is wrong in our sure as science mind, and the mathematics of knowledge, as Foucault put it. So this child did not respond to any kind of categorical treatment, returned back, and I decided to go ahead and admit him fully as if he were in severe malnutrition, which of course he was. But long story short, you can see that the child was very irritable, which is not unusual for someone in severe malnutrition, but you can see, and I don't think you can see it very well, some of the skin changes here. There's a dermatitis that he had it on the back, on the arms, on the belly, and I think the child did not respond even to the treatment of direct severe malnutrition treatment for marasmus, and he responded when I added niacin. So he had pellagra. I guess clinically he had pellagra. It's a very interesting thing. I remember having a child who had severe pain episodes, and he was presented to me by the previous physician in the notes as this is a chronic sickle cell patient who comes in for pain relief. And we don't go there with the enormous supplies of morphine and whatnot. And eventually I just realized that he has subperiosteal hematomas on his legs. So he had a partial chronic vitamin C deficiency. And once I treated him with high doses of vitamin C, the mother thought, of course, that I came from Mars, which is, not a bad thing every now and then. There's something about this photograph. We also include in the, TB ends up being one of the major causes for malnutrition. One of the interesting things about this photograph for me is the affect of the mother. She rarely smiled. Her child was chronically miserable, and did not respond to any kind of treatment. And when we started TB treatment, the child responded well. So sometimes, sort of like TB, you do it by exclusion. We don't always have the sputum. We cannot rely on the accuracy of the microscope technician. If we had one, sometimes we do, sometimes we don't. But also there are narratives that are personal narratives when you get to know the people that you try to serve, where you find out that the husband just got killed last week, and she has a 6-month-old child, and this one, and there are these horrific stories, and this is a picture of local medicine treatment. A child had intractable diarrhea and was becoming progressively malnourished. And one of the ways, and this is across in several places, where they will either sometimes go as cutting the uvula or searing the body. Those are sear marks. Basically to induce shock that might mount an immune response to overcome the original problem. And if you go through that shock therapy and you survive it, it works. Obviously they do it because it's a gamble, but it does work. And I took that picture with reluctance, and my reluctance is this. I think that it would be safe to say that for many of us, we would view this picture as true representation of our image of the other. And I'll use problematic words as the primitive or the barbaric or. But rarely, even within our medical community, but it does happen. Do we ever question the barbarity that we perform on each other, which sometimes is out of despair, which is no different than the despair that a mother has to watching her own child die and wanting to perform some sort of an extreme measure, a gamble as it may be, based on some objective data historically in their community. But I don't think that I think we do the same thing, which is in a way a very liberating and also informative. This child did very well once we treated the malnutrition. This is a child who had rabies, developed rabies. I took the picture of the child. He became, very confused and demented very quickly, and turned a corner, to my surprise. But only after I took the picture, I was happy. I was like, oh my God, the first time I saw rabies, treated it, and made a turnaround. After I took the picture, I realized that actually this is the son of an Arab boy. of an Arab man. And you come back to America, and when I talk about it, there's all this question about the politics of naming, or the racial importance of suffering, or the ethnic importance of suffering, and which baffled me when I came back, because obviously there are ethnic differences between, for the most part, between any two people who who brutalize each other, or one brutalizes the other. And the focus on the naming is sometimes necessary to give dignity to those who are brutalized and victimized. But at the same time, if it's not something that we're able to use and universalize suffering through, then there's a failure somewhere where it becomes a convenience of calling certain people certain names with too much certainty. Sort of like saying, what did the Rwandan genocide mean if it was two people of, there are two blacks, Hutus and the Tutsis, or they're both African, as opposed to this being an Arab is not an African, which is not necessarily true. The idea of the purity of races and identities and so forth is always problematic. It's easier to skip and say, don't we do that really with our patients here in the United States? So maybe we can also start here. So here's an example, again, we did have IV, obviously. We rarely used it. It's very problematic, and we still don't know how to hydrate malnourished people. Sometimes we end up killing the children because of it. And it's not just because we don't have labs that tell us what the value of the sodium and the potassium is, it's just because we don't know. Sometimes you just have to be personally engaged with the personal narratives and the affection. Here's another child who always refused to eat from his mom, but he could eat from the staff, the local staff, or from me. And this is a new discovery, and this is the a peanut gel, basically, instead of the porridge. This is high nutrition. Children like it very much. We ran into the problem also of, what do you do when a child gets this and loves it, and then he goes home to rice and beans? And this is a serious problem. It is amazing to also live in the moment of introducing something entirely new to, which is also a negligence of power, or a catch-22 of it. You come in and you say, here, did you hear about the new MRI thing? And before you know it, all hell breaks loose. And so this is on a much more practical, perhaps and dire level or example. The staff that we work with are local, which I guess assists in a sense of self-empowerment, and also, and the local economy as well. This lady is a Sudanese physician, also what is called an Arab. So she came in to help, hired by Doctors Without Borders, and obviously personal choice to come. This is a French nurse of Tunisian descent. The rest are, some are staff and some are mothers. Obviously we had balloon days once a week or once a month, depending on the availability of the balloons, and balloons are a universal happiness. There's pictures, kids wanting to take pictures, I think. Yeah, there's always somebody trying to shoot a gun anywhere in the world. Here's one of the nurses I worked with, Elizabeth. This is another thing we did. We had the capacity. When I was in Zambia, I did not have the capacity to transfuse, and so we always referred patients who suffered from severe hemolytic anemia to the hospital to get blood transfusion. Ironically, MSF learned from that experience, but had no clear data other than what the Ministry of Health of Sudan gave them on the presence of malaria in Darfur, so they equipped us with blood transfusion capacity. But there was really no malaria in Darfur because it's a semi-desert. There is not enough reservoir there. And so obviously this is something I never trained to do here, and I had to learn to do it there. And we did a pretty good job. It was wonderful to be able to transfuse people in need of blood. Most of our patients who received blood were women of childbearing age who had given multiple births and progressive, loss that they never, blood loss that, say, 5 kids in 4 or 6 years eventually caught up with you. This is our midwife, who's got magical hands and would make Leopold proud, the physician, and she averted many C-sections because obviously it was a lot safer to turn a breech child and then send them into the hospital. This is Miriam and her new baby. She was one of the patients I just mentioned where we gave blood to. This was our IV pole. Although the blood bags have an anticoagulant in them, the heat it was about 40 degrees Celsius, so we still had to wrap them in gauze and make sure that the blood transfusion went as fast as the body could handle it. This is the sky at the beginning of the rainy season. I think if you can remember, you can see a difference. And here are the streets, they flood, and this is where the radio station was. I think you can make calls from there. Another view of the street where we lived. Kids having a good time. I don't know if you see it. Do you see the stripe? I love that. Maybe a zoologist would have something to say, but what I want to point out in this photograph is this. This is, again, one of the food distribution days, and so somebody in the community realized, because of the weight of the things that have to be carried and the surface area, the size of the town, so he had a donkey that wasn't shot or killed or something, and a cart, and so he started running a business of transporting the food that gets distributed to people to the farther parts of the camp. So economies develop, sometimes, they do. And here's a view from the mountain. One of the things that we did after a while was realize, am I doing okay on time? Oh. Okay, well, maybe not. Was realize that we had to go do mobile clinic in the mountain where there are villages that were besieged and had absolutely dwindling resources and more illness. So we would pack our Jeeps once a week and go up in the mountain, have a flat tire, spend half the day fixing it, or have this. And these were the drivers and the nursing assistants, and they're incredibly talented people. And so we would pack the medication in one box, and and then would go. And the community would have a triage area set up for us, and in basically 7 hours we would have to triage. I have to go through with the nurse through 300 mothers and their children, and make sure I send them to the physician assistant and the nurse, and make sure that I don't miss anyone in that crowd who, if he or she has to wait another week, they'd be dead. So we brought a lot of children with us for the Malnutrition Clinic, but most of the other, and pneumonias and severe diarrheas, but most of the other times it was just treating skin infections, and occasionally we'd have to take some of the pregnant women with complicated pregnancies back with us. This was in the town, this was the hospital, this was the inpatient unit from the outside. She provided us with coffee, tea, and hibiscus, which was fantastic. And the red is the red ceiling here is to sort of help with the heat. This is a meeting with the community healthcare workers, so preventive care. They go around and they tell us news about what's happening inside the community, and they also do some education. Again, this is the triage area in the outpatient clinic. That's a water tank, obviously, there. And this is the registration area, the well, we didn't have any blood pressure machines, and neither will we be able to treat blood pressure, which is a chronic condition. So we just would take fever, weight of children, and height, and make sure that nobody's got a serious stunting of growth. And that's the cafe again. That is our dining table, and where I did some reading and writing. And then on the way out, they did this to everyone. They give you a plaque, and they have you wear the local dress wear, and they're very gracious, and perhaps too gracious at times. And this is a photograph of something that I've come in contact with. I had come in contact with often there, which is the soldiers. We obviously, as a medical physician, I am impartial. I take any comers, and we had plenty of comers from car accidents. The soldiers would be riding jeeps and driving maniacally, as only an 18 or a 20-year-old would, intoxicated with a sense of invincibility, and they would wreck each other and come in completely freaking out and calling for their mothers, like any one of that age might, or any other age, and wanting to go home because the severity of being in camp, was shocking. Also the fear of death and the normal sympathies that we know very well from our own standpoint of that end of brutality. And this was the boot of somebody that they left. He actually had an internal bleed, I think. He was bleeding from his ear and confused. And I did some basic treatment and rushed him to the hospital. I had no idea what happened to him. And there was just the boot left, and it was my own sort of memory of those interactions. It's very ironic to also be treating mini soldiers and or paramilitary people or whatever, militia tribesmen, or who also that have engaged in killing children with their cars, running them over, or actually shooting people deliberately or so forth. But like I said, it goes both ways. And this is a sycamore tree. It had many trees there, and one of them was the sycamore, or is the sycamore, and obviously can in some places grow to be pretty large and fantastic even in a semi-desert. And I'm sorry I got lost in time here, so thank you.
I think Debra should go on and
I want to remind you that Fady is reading tomorrow his poems. He's reading his poems at noon at Jefferson Hall. And because he didn't, Danny read a bit of a poem. I'm going to read a little bit more from that long poem, Pulse. And then I want to say some words about what it's been like to be reading his poems, and how my students and I have thought about them both as words coming from a doctor and also from a poet. So again, this is a long poem in many sections. The voices cross and together begin to make a kind of a story, but also an internal story that affects one at inarticulate levels, but very distinct at the same time. I'm just going to read a couple more sections. In the calm after the rain has bombed the earth, the ants march out of their shelters, one long frantic migration line. They hit the concrete floor of our dining and living space, then turn into the shadow the wall makes, a straight angle to the courtyard wreckage of dirt and gravel. Did they know the wind would airdrop new rations their way? It's always 2 or 3 ants locking their horns to the acid end over nothing. It seems more than an impulse, the debris plenty for all. This child wears its skin like spandex on the bone. There's a dry lake fontanelle. Fontanelle or foramen isn't the aesthetic alone, so what if you threw in Greek or Latin? Both are openings in the head, one is a lack of closure. This child has a mother whose husband was recently killed, a nascent narrative. This child was an old man once. This child heaves its ribs, its eyes are cholera eyes, pennies on a glossy screen, image in myelin. Time I came off it and told the truth, I don't feel good today. And just one more, and then I want to say a few words about this work. Halima's mother did not seem aware Halima was dying. You should have seen Halima fight for airlessness, twisting around for a comfortable spot in the world. She would gather all the air she could in an Olympic snatch and curl them toward her mother's breast to suckle, but nothing changed. Neither smell nor taste of mother's milk was proof of life. Halima died of a failing heart early this dawn. Her mother, with tears now, was on the road, 20 steps past me, before I turned and found her waiting. We walked back toward each other. We met, we read verses from the Quran, our palms open, elbows upright like surgeons ready to gown up after scrubbing, the slap of rubber gloves before we went our separate ways. My students and I have been looking forward to this occasion and to tomorrow's reading because we've been reading and studying poetry by Fady Joudah and other doctors who are or were poets, including William Carlos Williams. Like Fady, Williams was very interested in getting the voices of others into poetry and getting those voices of others into our heads. One of Williams' most famous lines reads, "It is difficult to get the news from poems, yet men die miserably every day for lack of what is found there." I have a feeling that one of the links between medicine and poetry is what each of these fields of study has to do with the political, nothing and everything. Fady's work is evidence of this connection. In his work with Doctors Without Borders, he has offered people whose circumstances interfere with decent medical care, a quality of health and a dignity that all human beings deserve. He does something similar in his poetry, which extends that very physical work of doctoring beyond the physical, offering to those of us who have not been workers with troubled populations a degree of clarity and understanding about scenes like those we have just seen in his slides. His poems allow the reader an imaginative participation in situations we would not otherwise know, and a chance to adjust our own energies toward considering and helping fellow human beings in situations we do know and beyond. By using language not simply to describe, but to physically embody the experience of others, to make it felt in a visceral way, Fady's poems bring his readers into the dramas and rhythms of scenes we might never be able to witness literally, yet nevertheless become present in. In medicine and in poetry, both precision and empathy are required. We all know about the studies showing that an individual witnessing another in need is more likely than a group to help that person in need. You who are doctors know what it is to be the one who can see clearly what help is needed in a particular situation. What happens in listening to Fady Joudah's poems is a kindred experience, that of perceiving precisely another human being's need, taking it in as something to act on, at least in one's own inner relationship to the world. Fady uses shifting images and perspectives to bring about that sense of intimate encounter with another. Sometimes it is even the self seen as if from a new point of view, but often it is someone very different from oneself who is brought to life in language, brought up close enough to be oneself. The poems don't offer solutions, they ask questions for the reader to ponder for himself or herself. In an answer to an interviewer who wondered about his intention with this kind of writing, Fady said, "I wanted the reader to feel complicit and not some protected, objective observer. Complicit in not knowing, or in knowing but not asking, what does one do with the task of redefining the meaning of suffering in the world?" Elsewhere he has said, "I feel a compulsion to address that line where the universal is the personal and the personal the universal." My class has been noticing how the language in his poetry, while continually engaging the reader with palpable detail, is also continually managing that altering of perspective that keeps one attentive to what's outside the self, yet also always attentive to one's internal self as it makes the associations among the riveting scenes in the poems. Meanwhile, a current of sentence structure or a repetition of phrase or word or sound will give the poem an intensity which suggests that beneath what one witnesses is an inward sense of necessity, of the mind's returning again and again to something under the surface of appearances, something more necessary. Fady's long poem Pulse, which Danny and I both quoted from, is one that my class read together, each student reading a different section, so that our various voices registered the different scenes and images, but also registered the recurrences in sound and rhythm and tone that link the scenes to form not only a story, but a sense of imperative about paying attention and responding to the questions raised by what one witnesses. Fady's words are not rhetoric, are not a call to specific action. They are poetry, a call to address our arguments with ourselves. I think Danny was maybe going to see about taking questions. I'll turn it over to you.
We do have an obligation to be on time, so I think if you have a question, you can have a one-on-one question and answer if you meet Fady and Debra upstairs. Thank you very much.